Hello, my name is Dr. Xiao. In today's episode of Hello, my name is Dr. Xiao Weibin. I'm from IMAGO Aesthetic Clinic, and welcome to our first episode of Aesthetic Doctor Answer series. In this series of Aesthetic Doctor Answers, we will be going through a few common questions that our clients and our inquiries have come up with, and hopefully we can all learn something together.
That's good.
So the first question I have over here is, I have a pretty good skincare routine and I do see visible results, but it seems that the results are usually temporary and not as significant as I would like them to be. So what are some of the ways that I can make the results longer lasting and even better than what I have? As we know, a lot of us use topical creams and makeup to hide away our blemishes, and usually you will be able to see results immediately. Like how some of my colleagues and I joked previously, is that even if you splash water on yourself, you will look very radiant and hydrated. But once that wears off, you have to do it again. So why is coming to an aesthetic clinic, how is it different? At the clinic level, we are basically targeting a deeper layer of the skin. So a lot of the topical creams is on the surface and cannot be absorbed into the skin. So things like collagen, hyaluronic acid, which is responsible for hydration and volume, these are usually being lost as we age and exposed to the environment. So as this gets lost, we need a better way of replacing them. So at the clinic, we do treatments that will target the deeper layer. So for example, if you are losing collagen, we will be able to do threading or machine-based treatment that will target deeper layers. So some of you may have done HIFU. These are machine-based treatment that targets different depths as well. There are treatments that we will replace the hyaluronic acid, which is responsible for hydration. Some of the common ones that you might have heard about are skin boosters, Profilo, Rejuven. These are all different ingredients and very natural ingredients that we replace that will help to speed up repair, regeneration and absorption of water. And these are usually longer lasting because they stay in the deeper layers of the skin. They do not evaporate or they get lost so easily. So the next question I have over here is, how can I get rid of acne? Acne actually by itself is a very broad condition which has many different components to it. So when we look at acne, we look at external and internal factors. Internal factors are a little bit more tricky because sometimes it's a bit harder to control. Things like stress, hormones, sleep, diet, all these play a part, and also they control the sebum and oil production as well. So that's one thing we target. The other thing that we target from the external point of view are all the bacteria and dirt that gets clogged up in the pores. So once these two combine, excess oil and then the bacteria comes on, it clogs up the pore, and your active acne comes on. So that's something that we want to treat. At the same time, some people come in with redness of the skin and also scars. So all these also have their own set of treatments that will target them better. So when we look at treating acne, there are many different treatments available. There is no one size fits all. Different people are tolerant to different kinds of treatment, and different treatments work better for different skin types. What type of treatments are available? These include lifestyle modifications. We also have topical creams, also oral antibiotics or vitamin A. If all these don't work and you come to the clinic, we have other treatments such as lasers. We also have chemical peels, we have injectables. So these are the three most common types of treatment that we do at the clinic. In terms of lasers, we further break it down into lasers with downtime and then lasers without downtime. For lasers with downtime, usually that's for resurfacing, that's the CO2 laser. That one's mainly for scar. Like if you have active redness of the skin, active acne, then we will do lasers without downtime. So foaming lasers and lasers that will help to kill the bacteria, control the oil production. Besides that, for me myself, I also quite like chemical peels. They target everything a little bit, so they help to regulate your oil production, help to kill off some of the bacteria, they help resurface the skin, and help to calm the skin as well. So that one you can do every 3 to 6 months. But if you have, let's say, very deep scars, then that one we may need to do other treatments such as subcision, fillers, and also other types of injectable treatments. We also have PDT, photodynamic therapy. Essentially, you are just lying there very comfortable. We shine lights of different wavelengths. This wavelength will target kill the bacteria, to calm the skin, to reverse some of the pigmentation and redness that you get from that. Okay, so the next question over here is, do aesthetic doctors get breakouts? Yes, because we are all humans. The difference is when we seek treatment and what treatment we do. So actually when I was young, going through puberty, that was quite a difficult time. I had to deal with active outbreak, had to deal with redness, not just over the face and also the neck. I had to deal with very deep scars. So everything that acne brings, I experienced them. Because when I was younger, I think all these aesthetic treatments are not as widely available, and there wasn't much knowledge about all this. So you just kind of live with them. And I would say that if I knew about the treatments available, it would have been a great help, not just the physical appearance, but also the mental and emotional trauma that I had to go through. So the difference is when you seek treatment, I would say once you start getting your outbreaks and it starts to bother you, it's a good time to come in just for a consultation. Doesn't mean coming to a clinic you have to do lasers or injectables straight away. You can just learn a bit more about the skin type that you have, what may be the major contributing factors to your acne, and some of the different methods that we can to treat them. At the clinic, we will customize the treatment according to your lifestyle, what you are able to accept, and definitely the treatments that we recommend have to be safe for you, and also we want to keep track and monitor the progress to see your results. Okay, so that's all for today. Thank you for joining me in this session of Aesthetic Doctor Answers. If you have any questions, just feel free to link up with us on our Instagram or TikTok, or subscribe to this YouTube channel. Yeah, so I'm go now.